In most of Africa, including Ghana, reverence for the dead includes a befitting burial, which is arguably a cultural belief. The belief is that the soul of the departed is then at peace as it transitions into eternity.
Now in Ghana, persons who died from COVID-19 must be buried. This is the duty for the environmental health officer, and it must be done with utmost care, protecting themselves and family alike. Our reporter Clara Mlano was with them at the day's training at Ga East in Accra.
In times of a pandemic such as this, COVID-19, all emergency responses are triggered to stem the spread and impacts on man. Despite ease on restrictions on movements of persons and work, the virus rages on, raising concerns of reinfection. The world death toll as of May 3, 2020 stood at 245,082, with Ghana recording 18 deaths. With the death toll on a steep daily rise, each country has come up with its own measures to bury its dead in line with health protocols. While some are buried, others are cremated for lack of adequate burial ground. All these are done by a special team. In the case of Ghana, the environmental health officers are to take up that task. Elsewhere, there have been instances where funeral parlors or persons mandated to supervise the burial of the dead refuse to handle the remains of the coronavirus patients. Their reason being inadequate logistics and transport to convey COVID-19 bodies. But what is the situation in Ghana?
It is all about treatment. Government is making budget for contact tracing. He's making budget for case testing. He's making budget for case treatment. But they are forgetting that should somebody is not able to fight the disease, the person may pass on. And if this person passes on, who buries the person? In fighting an infectious pandemic case, when the person dies, the body becomes the state property. The body is no more for the family members. And who supervises the burial? It is the environmental health officer who supervises the burial. But the issue is, we are not under Ministry of Health. We are under the local government service, where we go down into the communities to be with the communities. So we are in the communities educating people. As I'm talking with you, officers go to the field. We don't have masks. We have to buy masks ourselves to go to the field to educate the public. Now, wearing of masks has become mandatory. Who is supposed to do the enforcement? It is the environmental health officer who is supposed to do the enforcement. How do we go out there to meet the public to do this enforcement? All these things are things that we want the government to know that we have been left out in the fight of the pandemic. And you can never leave out environmental health officer when you are fighting a preventive diseases.
Here at Ga East in the Greater Accra region, about 30 environmental health officers went through a day's training on COVID-19. It included clinical management of COVID-19, team dynamics, transportation of patients or bodies, hand hygiene, cleaning, disinfection, and burial of COVID-19 victims, community and decontamination. But Madam Florence Kui, Director of Metro Public Health of the Accra Metropolitan Assembly, is not happy. She says the day's seminar was not adequate preparation.
This is the first kind of this training for environmental health practitioners in Accra. And looking at Greater Accra, we have 29 MMDAs within Greater Accra. But the people we are seeing here are only people from Accra Metropolitan Assembly. So what happened to our friends, our colleagues at the other regions, assemblies? What happened to them? We don't know what is going to happen to them. We are going through the training. After the training, what next? We don't even have logistics like PPE. Before you can carry a dead body, you must be in full gown. Before you can carry the body, before you go to do disinfection of a hospital or a contact patient's premises, you have to be in gown. You need logistics like disinfectants and other things to do those things. You need a knapsack machine, you need a machine gun for the disinfection. But we don't have any. Not even talking of a vehicle to even convey the body. Because I can't use an ambulance to carry the dead body. It's supposed to be a haste. But when we are fighting pandemic, we don't use an enclosed haze to carry the body. You need a pickup that the back is open, where you place the body either in a body bag or in a coffin.
Resource person Dr. Chris Osine said the training is to keep the environmental health officers abreast with evolving guidelines of preventing, managing and burying COVID-19 patients.
Burials do not happen in our facilities. It happens under our municipalities and our district assemblies. It became important going forward with the number of deaths we already had to prepare those who may not be just facility-based but who are under AMA, to prepare them for infection prevention control in the context of COVID-19 and burial of our people. That whenever there's an evolution of guideline, that we're dynamic enough to update our guideline and then retrain people to prepare them for that. From the initial decision as to whether we, as a country, we wanted to bury people, whether I wanted to do postmortem and all that, there's been guides from WHO and from other bodies as more information became concretized.
Under the current circumstances, what is the burial policy for COVID-19?
When there is a death of a COVID confirmed patient, it's the state's responsibility to bury the dead per our protocol. What the state does is usually will be to support the relations. So the body is handled by the state, but the relations are allowed to organize a decent burial for their relative. If, however, they want the state to do the burial on their own, the state might have to take up that responsibility. But generally, as at now, what happens is that we have a dialogue with the relatives. They decide what they want to do, but then the burial will be supervised by the state. The body will be prepared by the state. And by the state, I mean, for example, in Ga East, we will take responsibility for preparing the body, making sure it's put in a casket. And then we have the environmental health officers, some of who are currently with us here, who will supervise the safe burial of that.
Being a human-to-human transmission virus, the environmental health officers want more to avoid compromising their safety. For GBC News, Clara Mlano reporting.